To reduce the risk of tumors, there are two ways. 1. Through individuals' awareness, stay away from carcinogens and situations that are often associated with cancer. 2. Undergo screening procedures, as many tumors can heal through early diagnosis and treatment. The general practitioner, by himself, with no help from specialists, is able to draw schedules, prescribe and make decisions based on the results of screening tests. The inhalation of any type of smoke, from cigarette, cigars, marijuana, fireplaces, cars or industrial exhaust, is not only a cause of lung cancer, but also pancreatic cancer and esophageal cancer. All three of these not only kill, but kill slowly through suffering. Therefore, it is advisable not to smoke and to avoid smoky environments. Above all, due to the cumulative effects, it is important that parents watch carefully over their children. Radon, an odorless radioactive gas, should be included with the causes of lung cancer. Radon may concentrate in dwellings through emissions from porous soil. Frequent ventilation of domestic premises is the best defense. The saying that one's weight should be equal to the number of centimeters of high minus 100 is still valid. Obesity is up as a predisposing factor for many types of cancers, as well as diabetes and cardiovascular diseases. It is recommended to 1. Walk whenever possible, for example while avoiding elevators or reducing car use for short distances to bridge. 2. Feed with low salt intake diet. Diet should be rich of fresh fruits, fresh vegetables, and whole grain legumes. Conversely, it is better to avoid canned meat and other ultra-processed food because the addicted preservatives are not under the consumer's control. 3. Not consume large quantities of sweet or sugary drinks. However, between sugar and sweeteners, one ought to prefer sugar, which is a natural and readily metabolized product. A teaspoon of sugar in coffee hurts nobody. Especially in young people, alcohol is toxic to the liver, pancreas, and esophagus. A glass of wine a day is not a problem, while spirits can be, especially if homemade. Many precancerous diseases and skin and eye cancers are caused by exposure to ultraviolet rays. Therefore, we recommend wearing sunscreens with a sun protection factor of over 30, hats and sunglasses in case of exposure to ultraviolet rays for a prolonged period, especially from May to July. Italy is a leading country in occupational medicine and has strict regulations. The competent doctor is the referring advisor. Breastfeeding protects against breast cancer. UNICEF recommends that the first 6 months be exclusively for breastfeeding. Then, when weaning is started, continue complementing with breastfeeding as long as possible. Hormone replacement treatments, including the contraception pill, increase the risk of breast and uterine cancer. Chronic hepatitis B is a risk factor for liver cancer. Vaccination at birth eliminates infection. Teenagers of both sexes should all be vaccinated against papillomavirus. Infection by papillomavirus may cause genital tract tumors. Through palpation of the breast, the general practitioner is able to provide guidance on benign pathologies such as fibrocystic mastopathy, and periodically search for newly emerging nodes. The breast can undergo cancer screening, also by means of mammography, in principle as often as 2 years from 50 to 69 years of age. Cervical cancer develops slowly. A cytological examination, pap test, as often as every 3 years from 25 to 64 years of age is very supportive. In adults of both sexes, the tumor of the large intestine is monitored with a search for blood in the feces, as often as every 2 years, followed by a colonoscopy with a flexible endoscope in case of positivity even in only one of the samples. The presence of visible blood in the feces should be reported to the general practitioner.